Today, we're exploring a subject that has sparked debate, controversy, and even legal battles for decades. The world of cancer treatment and the controversial substance known as Laetrile. Now, if you're like most people, you might have heard whispers about Laetrile, often referred to as vitamin B17, and its supposed ability to combat cancer. But what is it really? Is it a miracle cure suppressed by powerful interests, or is it simply quackery, as many mainstream medical organizations claim? Today, we're going to delve into the fascinating and complex history of Laetrile, drawing from the groundbreaking book World Without Cancer by G. Edward Griffin. Let's start with the basics. Laetrile is a compound derived from the pits of apricots and other fruits. It's been touted as a natural cancer treatment, but its journey has been anything but smooth. The theory behind Laetrile is rooted in the idea that cancer is a deficiency disease, much like scurvy or pellagra. According to this view, cancer is not caused by some mysterious virus or toxin, but by a lack of an essential food compound in our modern diet, specifically vitamin B17. Now, this idea might sound revolutionary, but it's important to note that it was first proposed by Dr. Ernst T. Krebs, Jr., back in the 1950s. He believed that by restoring this missing nutrient to our diets, we could prevent and even treat cancer. But here's where things get interesting. If Laetrile is indeed a simple, natural solution to cancer, why isn't it more widely accepted? Well, that's where the plot thickens. The medical establishment, including the FDA, the American Cancer Society, and the American Medical Association, have consistently labeled Laetrile as quackery. They've argued that there's no scientific evidence to support its effectiveness. But here's where we need to dig deeper. What constitutes proof in the world of medicine? As Griffin points out in his book, the term proven can be misleading. In the strictest sense, there's no such thing as absolute proof. There is only evidence that convinces some observers and not others. The FDA's definition of proven is a technical one, requiring rigorous testing protocols that are often prohibitively expensive and time-consuming. This raises a crucial question. Are these protocols truly designed to uncover the truth, or are they set up in a way that favors certain outcomes? Let's talk about money. The pharmaceutical industry is a multi-billion-dollar business, and new drugs are patented and sold at high prices. Laetrile, on the other hand, is a natural substance that cannot be patented. This means that there's no financial incentive for large pharmaceutical companies to invest in its development or testing. In fact, it could be argued that they have a vested interest in discrediting it. This brings us to the heart of the controversy. Many proponents of Laetrile believe that there's a deliberate effort to suppress information about its potential benefits. They point to instances where studies have been manipulated or suppressed, and where doctors who have used Laetrile have faced harassment and even legal action. One of the most shocking examples is the case of Dr. Kanematsu Sugiura, a senior researcher at the prestigious Sloan Kettering Cancer Center. In the 1970s, Sugiura conducted experiments that showed Laetrile was effective in stopping the spread of cancer in mice. But when his findings were published, they were met with resistance and attempts to discredit them. In fact, other researchers were brought in to replicate his experiments, and when they confirmed his results, the studies were buried. This kind of suppression is not unique to Laetrile. History is replete with examples of scientific breakthroughs that were initially ridiculed or suppressed by the establishment. Think of Galileo, who was persecuted for suggesting that the Earth revolved around the sun, or Dr. Ignaz Semmelweis, who was ridiculed for advocating hand-washing to prevent infections. So, what does all this mean for the average person facing a cancer diagnosis? It's a difficult question. On one hand, the medical establishment insists that Laetrile is unproven and potentially dangerous. On the other hand, there are countless stories of patients who have turned to Laetrile as a last resort and experienced remarkable recoveries. Take the case of Alicia Buttons, wife of the famous actor Red Buttons. After being given up as terminal by mainstream doctors, she sought treatment with Laetrile in Germany and reportedly experienced a complete remission of her cancer. Stories like these are not uncommon, and they raise important questions about the nature of medical evidence and the role of personal choice in healthcare. Ultimately, the Laetrile controversy is about more than just a single substance. It's about the broader issue of medical freedom and the right of individuals to make their own healthcare decisions. It's about questioning the motives of powerful institutions and considering alternative viewpoints. And it's about the urgent need for more research and open-mindedness in the field of cancer treatment. As we conclude this episode, I encourage you to think critically and do your own research. The truth is often complex and multifaceted, and it's up to each of us to seek it out. Thank you for joining me on this journey, and I hope you'll tune in next time as we continue to explore the fascinating and ever-evolving world of health and science.
This has been a BrightLearn video from BrightLearn.ai on the book World Without Cancer by G. Edward Griffin. Visit BrightLearn.ai for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.